A Kelly File follow-up now on a stunning turn of events tonight involving the president's health care law. This bill was sold as an effort to expand coverage to uninsured Americans. But tonight a new report finds as few as 11% of those who have signed up for Obamacare have been lacking insurance prior to signing up. The vast majority of people who are signing up already had insurance, just moving from one plan to another. Jonathan Gruber is an economics professor at the Massachusetts Institute of Technology. He is one of the architects of Obamacare and one of the authors of the Massachusetts Health Plan. Good to see you again, sir. So those are not good numbers.
Well, look, Kelly, I think there's four things you have to keep in mind. First of all, as I've emphasized repeatedly to you, it's early. The end of open enrollment is the end of March.
We got 70 days left.
We have 70 days left. What we know from all previous examples, like in Massachusetts or Medicare Part D, is there's a big rush at the end, so it's just too early to say anything.
Really?
Second of all, this 11% number was from a survey of 400 people. There's 2 million people who signed up for the exchange so far. I don't think we can make a lot of hay out of a survey of 400 of them.
Let me jump in on that one and just ask you about that, because there are several surveys cited in this Wall Street Journal article, and all of them point to the fact that many of the enrollees had previous coverage, and they go through the names of the insurers who talk about, Health Markets, Inc., an insurance agency that enrolled around 75,000 people or 7,500 people. 65% had prior coverage. At a Michigan-based Priority Health, 75% of those enrolled had prior coverage. And so it's not just the survey, it's also the insurers coming forth one by one to say, yep, I'm having the same experience.
And, well, that leads to my next point, Megan, which is it is true that many of the people who sign up for Obamacare will have had previous insurance. Let's take a simple example, which is Medicare Part D, the last big government expansion of insurance, a popular program. 80% of the people who signed up for insurance under Medicare Part D had drug insurance beforehand, but it's still a success. Now, that number is going to be much lower under Obamacare. I predict it'll be around 50%, but we can't really evaluate it till the numbers are in, and we have to recognize that a lot of the people who sign up who used to have private insurance would have lost it if they weren't able to go on the exchange and get new coverage.
Let me ask you this, because you say it's, it's early. I mean, there's only 70 days left, so it's not as early as, it once was, to state the obvious. If the numbers stay around here, where you have, only 25% of the people signing up who actually were uninsured, what does that mean?
I think that would be a problem if the number ends up that low. I think that basically if you say that in the end of the day, that there's only 1 out of every 4 people joining the exchange was uninsured, I think that's too low. That's not what the estimates suggest. And I don't think that's where we'll end up. But we'll have to see when the data becomes more reliable at the end of the year.
All right, I'll see you in 71 days.
Sounds good.
All right, good to see you.